Happy holidays, everyone. This is a stressful time. Not for me, because I'm married to her, but...
I can be stressful. And I can get stressed.
It's a hard time for a lot of people. I did an interview this week on managing depression during the holidays, and I'm like, we have to talk about this on our channels. Tell us where you're from. That always makes us happy. And, you see the Christmas tree behind us actually had nothing to do with me. Tana
This year,
this.
some of you saw my video from a few days ago. I talked about, I didn't post anything during Thanksgiving. It's the first time ever, for a week, I didn't post anything live because I ended up in so much pain. It's probably some of the worst pain I've ever had, like a 12 on a scale of 1 to 10. I was in tears, could barely get up the stairs, and was just down. And so my back just was out, gone. Never had pain like that. It was crazy. And so I was getting pretty worried. And I told the kids this year, I'm like, if we're going to have a tree, you guys are going to have to basically do it. And so I kind of was here and whatever, but didn't really do anything. But I want to get to that in a minute. And I started to realize it was sort of an accumulation of stress. And I'm reading this really, really good book. I've read it before. I'm reading it again, recommended to me by someone. And it's the Mind-Body Prescription. And it's really good. And it talks about how so much pain, especially back, shoulders, hip pain, is so often because of stress. And he goes into, he talks about how, yes, it's in your head, but not the way you think. Really when we have these emotions that things stack and get to be too much, or we have severe trauma, or we have lots of different stress. It's just different for everybody. But if you have a lot of stressors, in my case, it was just a stacking effect of a lot of things and being way too busy. And I finally hit this threshold, and it's your brain, it's sort of your brain's way of distracting you, if you will, from the emotional part of it. And so you end up developing this physical pain. And what happens is when you're constantly tensing muscles, it closes down the oxygen. And so when you lack oxygen, you lack blood flow, and you get dis-ease or disease or pain, right? So there's actually a very strong biological reason for it. It's not just people don't like the term psychosomatic, but that really is what psychosomatic is when it comes to pain. So super good book, The Mind-Body Prescription. And I started to go back to my old strategies because I was so busy. I wasn't doing the things to take care of myself, like meditating every day and, doing the things. I was doing everything to ignore the pain, push through the pain, and just not deal with the pain. We always want to block pain, right? And so instead I'm okay, I started deep breathing and asking, what is the pain trying to tell me? Or for some of you who are sort of mismatchers, what is the pain distracting me from knowing? And just asking myself, meditating and praying and doing that. And it really, really started to, over about 4 days, it began to really alleviate. And so, it's not gone, but I'd say it's a 1 or a 2 now. Big difference.
So many people are afraid of their minds. Mm-hmm. And so they do everything to block it.
Yeah, self-protective.
Whether it's alcohol or binge watching television or bad food. And going into the pain is often the most effective thing you can do. All right, let's shift and talk about the holidays.
I just thought that was appropriate because a lot of people have that same
so many people
stacking thing, and they just shut down
with pain. Well, and it actually starts. So when I think of holiday stress, it starts with the time change. Mm-hmm. The time change, which I'm so happy is hopefully going to go away soon. It all of a sudden you get an hour less light. Mm-hmm. And we know that light is critical to feeling happy, to feeling
and you have
positive,
jet lag
to
for
having
a month.
energy. And the incidence of depression spikes after the time change. And then you have Halloween. And all of a sudden, more bad food.
And
Halloween is the gateway holiday to hell. And then it's Thanksgiving, it's the holiday parties, it's Christmas, it's New Year's Eve, all of these things filled with stress, alcohol, and sugar.
And by the way, Christmas Day is the number one day of the year for heart attacks statistically. So
when you were working as a nurse, they actually wouldn't let you take that off, right?
Well, you can't. If you're a healthcare provider, you can't take holidays off. You often get to switch off. You get to alternate yearly between Christmas Day and Christmas Eve, but you can't take holidays off. So, yeah.
And so you can just see sort of the shit show going into the holidays and why the depression spikes. Now, fun fact that people actually don't know is that December is the lowest month of the year typically for suicide. Why? People have hope that something will turn around. April tends to be the highest month.
Strange.
And again, the time change, but now people have been thinking about suicide, have energy. And it's either that or income taxes. I don't know. Which
Could be the IRS.
So how can you manage during the holidays? One, you have to set the expectations. If you're doing it based on what your family thinks you should do, stop that. Because, Tana and I often say, you train people how to treat you. And if you give in to guilt and shame and all of that, you're teaching them you can be manipulated.
Well, and
guilt.
this is true in many ways. It's true with food, and it's true with parties, and it's true with alcohol. It's true with all that, but it's also true with expectations. So part of the stress, especially, like even what I went through, is there's these expectations to throw parties, expectations to go to parties, expectations to decorate, expectations to cook. It goes on and on and on. And, people are relying on you, and you have all these ideas about what people expect of you. But the truth is, if it doesn't have eternal value, it doesn't have to happen. Your health needs to come first. And so when otherwise your body's going to tell you, if you don't give your body a break, your body's going to take a break at some point. And so when I really laid it out, I'm like, we're not having a tree unless you guys help. We're not going to do the full decorating like we normally do. I'm not cooking for Thanksgiving. It doesn't actually have to happen. We went to his family's house. His family's amazing. Everybody cooks. And so.
Well, and you contributed.
You can
be more creative.
Well, Chloe did. She was amazing. So now my daughter's old enough. But you can engage other people. You don't always have to be the superstar all by yourself. So stop with the perfectionistic thing and think more holistically, about protecting your health.
So someone's asking again about the name of the book. It's The Mind-Body Solution.
No, Prescription by John Sarno.
Mind-Body Prescription. And if you get your mind right, your body often follows. And I often say if you get your brain right, your mind
and he would agree with
follows.
you. He would agree with you. Yeah. So.
And a question on how to overcome a toxic mother is less time. It's so important.
I have a saying that I use because my book, The Relentless Courage of a Scared Child, is about sort of growing up with crazy family. And my saying for that is forgiveness is critical. It's key because if you can't forgive them for them, you forgive them for you because it's toxic for you not to forgive. But I love you and I will miss you. So there's some people you love from a distance or you limit your time with them.
Well, and clearly one of the most stressful parts of the holiday season is you're spending more time with your family. And if your family was stressful, there are 30 million children and grandchildren of alcoholics in the United States. And there's a very high incidence of post-traumatic stress disorder. And Tana and I often talk about people who have high ACE scores, adverse childhood experiences. Well, you're often forced in your mind to go spend a lot of time with them at the holidays. And I often suggest to my patients is, if you want to do it, only if you want to do it, only if it's in your best interest to do it for a defined period of time. Go stay at a hotel or an Airbnb. Don't go stay with them. If it was a toxic situation, so many people believe, it'll be different. And we often say the best predictor of behavior is behavior.
I just remembered something, so I have to share one. So, and just, you got to learn to be honest. So we took a family vacation that lasted literally 24 hours.
People were hearing the cat.
Oh, God. Okay, anybody else, I love the cat, but anybody else have issues with cats because you can't keep them off counters and tables? I find myself cleaning counters and tables all day long. It drives me crazy. The nurse in me just okay, anyways, but that's my little side note, but he is sweet. Back to what I was saying. We took a family vacation to Yosemite. It lasted 24 hours. The drive, I think, was longer than the actual time we spent there because it just was not going well. So with all the kids, it just wasn't going well. There was so much drama and stress, and we all looked at each other and we're like, this isn't fun. We're going back home. And everybody agreed, and we just left. So we are not immune to this, but we've all decided we're just it's not worth it to, try and make something work that's not working. So that was super interesting. We were a little traumatized.
And it's good to write these things down. So whenever someone goes, hey, let's take a long drive together.
Right.
We realize if she and I take a long drive together, we're awesome.
Car full of kids, no.
Car full.
And I remember we took a family vacation one time and Daniel looked at me, he goes, the next time that I think this is a good idea, make sure you remind me of this trip. Because he goes, I'm going to think this is a good idea again.
Why are you throwing me under the bus?
No, they can relate to us. I think we have to point out that, people think that sometimes because you're in the mental health space or, you do this for a living, that you've got it all together and your family is perfect. And it's just so not true.
That you're mental.
Yeah.
All right. Practical tips. Head to head against antidepressants. Exercise has been shown to be equally effective. Walk like you're late, 45 minutes 4 times a week. Do not let the stress of the holidays prevent you from exercising. Make sure you're taking omega-3 fatty acids and saffron. BrainMD makes Happy Saffron, and it's like our 4th best-selling product now, and we only released it 2 years ago. People just love it. Don't believe every stupid thing you think. Mm-hmm. This is really important. If you're feeling stressed, write down what you're thinking. I have to do all these things. I have to do all these things. I don't have to do all these things.
You're going to be shocked at how effective that is.
And when you feel like the past is just crashing into the present, go get some EMDR. Can be just incredibly
100%.
helpful. Or do havening. Just this simple motion with your hands.
Or this.
This is a technique to help significantly decrease stress. So if you're at the dinner table for Christmas and they're bringing up, this has happened every year for
I know so many good stories of you.
Years. Yes, when I was 5, I was with my sister Jeannie, and we found wire matches out when there's a 5-year-old around, and we lit the couch on fire.
Was that you that put the rubber band around the baby's neck?
No, it was not an attempt. I never attempted murder. So.
One of them put the rubber band.
No. But these stories, they happen over and over and over. So when you're at the table and someone's making fun of the fact when you were 5, you lit the couch on fire, just gently go like this or go like this, so you don't have to get up, walk out, and go really we have to talk about this
again
for the
and
60th
again and
time.
again. Yes.
This is why holidays are stressful.
And the other one, my personal favorite, is boundaries, boundaries, boundaries. So you have to learn how to say, I will think about it, or my favorite word, no. No, no thank you, no way, no how, however you want to say it. You've got to learn how to say no.
Well, and one other tip while we're doing tips. When someone offers you a drink, don't say, oh, I can't. Say, oh, I don't drink. Because when you identify with the positive rather than identifying with someone else's controlling you, you're going to continue to make good decisions. Oh, I don't drink. I mean, I don't drink, so it's really easy with me. Oh, come on, have a drink. I just look like, so why do you want me to drink when I don't want to drink? What's the matter with you? Alcohol does not make holidays merrier. It's generally way more toxic, and people make worse decisions during the holidays.
So as expressed in my book, The Relentless Courage of a Scared Child, so a lot of family members, let's just say that the police came more on holidays than most times to our houses because of alcohol. So fortunately, my mother didn't drink, but yeah, it was a very interesting thing.
Well, and a couple of years ago,
meth didn't help either, or heroin, but you know. So.
A couple of years ago, we adopted our nieces, and I guess it was about 6 years ago they became part of our lives, and they've been with us at holidays. And initially, it was sort of boring for them because
the older one got depressed. Alize got depressed. She started trying to find problems, and she didn't know what to do with herself. Yeah, it was interesting. I'm like, what are you doing? You need to knock that off. That doesn't work in this house.
Because they were so used to chaos and drama at the holidays. Now, chaos and drama would horrify them.
Yeah.
So they're now used to a new normal where people very much like each other and can celebrate with clarity and love rather than hysterical anger.
Oh, someone said that's my niece's name. How funny. I've never heard anyone with that name. They asked how old they were. When they came to live here, they were 14 and 12? No. Yeah. 14 and 11 or something?
Yeah, just about 3 years ago.
Yeah. Or 10 and 14, yeah.
No, she's 12 now. So
10
and
like
14.
Yeah.
Anyways, we hope you have a very happy holiday. Hope this is helpful. We'll be back.
Someone asked what EMDR is, just really quick.
It's such a
my
good
favorite
treatment.
therapy for trauma.
Eye movement, desensitization, and reprocessing. It's very effective.
Yes.
Very effective.
Awesome. Thanks.
All right, take care, everybody.
That was fun.